That hard, swollen feeling in your stomach is not always fat. Sometimes it is backup, trapped stool, trapped gas, trapped water. And if you care about your health, stay with me. Because what you are about to hear could explain why your belly feels heavier, your energy feels lower, and your body seems stuck no matter what you try. Most people hear a title like "Flush 10 pounds of toxic waste" and roll their eyes. Fair, your body is not hiding a bag of poison in your gut. But here's the part that should get your attention. Waste can sit too long in your digestive tract. Gas can build, water can get held, your belly can stretch, your appetite can go weird, and the scale can look worse than it should. So if you have been drinking green juice, eating healthy, cutting calories, and still feeling puffy, sluggish, and backed up, this video is for you. Because the hidden problem is not always what you eat, it is what your gut fails to move. I call it the colon brake. Think of your digestion like a long airport conveyor belt. Food gets loaded on one side, waste should move out the other. But if the system slows down, bags pile up, then more bags come in. Then the whole belt jams. That jam does not just make you uncomfortable, it changes everything. This is why nothing worked before. You were trying to burn calories while your body was quietly dealing with traffic. And once that traffic starts, it creates a chain reaction. You feel bloated, so you move less. You move less, so your bowel slows more. You get constipated, so the scale stays up. The scale stays up, so you eat less or panic. Then stress kicks in, and stress presses even harder on the colon brake. It doesn't stop there. Slow bowel movement can make you feel full when you should feel hungry. It can distort your waistline by inches. It can leave you gassy, foggy, and drained. Chronic constipation is also common. In Japan, survey data found notable constipation prevalence in adults, especially women, which is one reason non-drug daily habits get so much attention there. Source, and it gets worse. When waste sits too long, more water gets pulled out of it. That makes stool harder. Harder stool is harder to pass. Then you strain. Then you avoid going. Then your body starts treating discomfort like normal. Here's the scary part. Some people spend years fighting belly fat that is partly bloating, backup, and water retention. Not all of it, but enough to make you feel trapped in a body that is not telling the truth. But here's the problem. Most people attack this the wrong way. They buy detox teas. They starve themselves. They slam fiber without water. They ignore the nervous system. And that last part matters more than almost anyone realizes. Your gut is not just a tube. It is wired to your brain. When you live in stress mode, your body shifts toward survival. Blood flow changes. Muscle tension rises. The rhythm of digestion gets less coordinated. One study on slow, deep breathing and constipation, predominant IBS, found that after 6 weeks, people improved stool consistency and increased spontaneous bowel movements, with signs of enhanced vagal activity, the calming side of the nervous system. That is why today is not about a fake cleanse. It is about releasing the colon brake. And I am going to rank the top 5 habits from least to most effective. Stay with me, because the number 1 method is the 1-minute Japanese habit most people have never tried correctly. It works differently from everything else on this list. It does not just add bulk. It does not just add water. It helps your gut switch gears. Number 5 is warm water first thing in the morning. Simple, almost boring, and that is exactly why people ignore it. Warm water acts like a gentle wake-up signal. It can help relax the digestive tract and support movement, especially after hours of sleep and dehydration. In a randomized study, patients who drank warm water after surgery passed gas much sooner than the control group, suggesting faster return of intestinal movement. Why does that matter to you? Because your gut loves rhythm. Morning hydration tells your system the fast is over. The day has started. Movement can begin. But here is the limitation. Warm water is not a magic flush. If your colon brake is locked by stress, inactivity, or chronic sluggish motility, warm water alone is like nudging a car with the parking brake still on. So here is the exact usage. Drink 1 cup of warm water within 10 minutes of waking. Not boiling, not ice cold, warm enough to feel relaxing. Sip it slowly over 1 minute. Then walk around your house for another minute. Here is the warning. Do not force huge amounts. More is not better. Chugging too much water too fast can leave you nauseated. And if you have fluid restrictions from kidney, heart, or medical issues, follow your clinician's advice. My score? Warm water gets a 5.8 out of 10. Helpful, gentle, easy to start, but not powerful enough to unlock the deeper issue. And no, this is still not the Japanese habit I teased. Number 4 is prunes. I know, not glamorous, but prunes do something many trendy detox powders fail to do. They actually help stool move. They work through fiber and natural compounds like sorbitol, which can pull water into the bowel and soften stool. In a randomized trial, Dried plums outperformed psyllium for complete spontaneous bowel movements and stool consistency in adults with mild to moderate constipation. The study used 50 grams twice a day. That matters because harder stool is one of the main reasons people feel blocked. Softer stool means less straining. Less straining means less fear around going. Less fear means less holding, and that loop matters more than you think. But most people get this wrong. They either eat too many at once and end up cramping, or they eat a few for one day, see nothing, and give up. This is where things change. Use them like a tool, not a binge. Start with 4 to 5 prunes in the evening, or around 50 grams a day if your gut is sensitive. Give it 3 days. Drink enough water with them. Warning here: if you have IBS, are very sensitive to FODMAP foods, or spike easily from sugar, prunes may backfire and cause gas. That does not mean they are bad. It means they are not the best first move for everyone. My score? Prunes get a 6.6 out of 10. More effective than warm water, still not the best. And still not number 1. Number 3 is walking after meals. This one sounds too easy, which is why people underestimate it. Walking is like shaking a stuck vending machine, just enough to get things moving. Not violently, just enough. Your colon responds to movement, your whole digestive system responds to movement. A systematic review and meta-analysis covering 13 cohort studies found that higher physical activity was linked to lower constipation risk, and high activity levels were associated with substantially lower risk compared with low activity. That is huge, because it tells you something simple. Your body was built to digest in motion, not all day in a chair. But here's the problem. People hear exercise and imagine sweat, pain, and an hour at the gym. That is not what I mean. I mean 10 minutes. Especially after dinner. Especially when your belly feels full, tight, or trapped. Walk at a comfortable pace. You should be able to talk. You should not feel like you are training for anything. You are giving your gut a rhythm cue. Here's the limitation. Walking lowers risk and supports motility, but if your stress is high and your breathing is shallow, you may still feel blocked. Movement helps. It does not always reset the hidden mechanism. Exact usage? Take a 10-minute walk after your biggest meal. If that feels impossible, do 5 minutes after lunch and 5 after dinner. Consistency beats intensity. Warning: do not go hard right after a heavy meal. Gentle is enough. If you get dizziness, pain, or bleeding, stop and get checked. My score? Walking gets a 7.2 out of 10. Solid, reliable, underused. But the next two are where the real shift begins. And number 1 is the habit that can make the others work better. Number 2 is abdominal massage. This is where people start realizing the gut is mechanical, not just chemical. Your colon is a tube of muscle. Muscles respond to motion, pressure, rhythm, and relaxation. Abdominal massage works like helping toothpaste through a soft tube. Not by crushing it, by guiding it. A recent review concluded that abdominal massage can reduce constipation severity, improve bowel movement frequency, soften stool, reduce straining, and even improve quality of life in adults. That is not hype. That is your body responding to touch and direction. Most people who try this get one thing wrong. They massage randomly. They poke the belly hard. They do it for 20 seconds and expect fireworks. Here's how to do it properly. Lie down or recline. Relax your stomach. Start at the lower right side of your abdomen. Move upward, across the top, then down the left side. Slow circles. Clockwise. About 5 minutes. Gentle pressure. Think guide, not attack. Why clockwise? Because it follows the general path of the large intestine. But here is the limitation. Massage helps from the outside. If the nervous system is still locked up from the inside, relief may be partial. Warning: skip abdominal massage if you are pregnant unless cleared, have recent abdominal surgery, severe pain, hernia, unexplained bleeding, inflammatory flare, or a medical condition that makes pressure unsafe. My score? Abdominal massage gets an 8.1 out of 10. Very effective, very underrated, still not number 1, because the number 1 method does what massage, walking, and warm water only do partly. It works on pressure, rhythm, and your nervous system at the same time. This is the 1-minute Japanese habit, tanden breathing, and this is where things change. In Japanese body practices, the tanden is the lower belly center, the area below your navel. The idea is simple. When you breathe low, slow, and with control into that center, your body stops acting like it is under attack. Your abdomen moves, your diaphragm moves, pressure waves move, and your gut gets the message. Move. In a randomized controlled trial from Japan, women who practiced tanden breathing daily for 6 weeks saw constipation scores drop sharply, from an average of 7.2 at baseline to 3.1 by week 6. The intervention group ended up 4.3 points lower than controls on the constipation scale. Read that again. A breathing habit changed bowel outcomes. And another study on slow, deep breathing found improvements in stool consistency and weekly spontaneous bowel movements, along with enhanced vagal activity. That is why this beats everything else on the list. Warm water helps hydration, prunes help stool texture, walking helps motion, massage helps from the outside. But tandem breathing stacks multiple mechanisms together. It calms the nervous system. It changes abdominal pressure. It gently mobilizes the belly from the inside. It may help release the colon brake. And unlike a tea pill or gimmick, you can do it anywhere. So here's the exact 1-minute method. Sit tall or stand relaxed. Put one hand just below your navel. Loosen your jaw. Loosen your shoulders. Inhale through your nose for 4 seconds, and let the lower belly expand into your hand. Do not lift your chest. Keep it low. Then exhale slowly through your mouth for 6 to 8 seconds, and gently draw the lower belly inward at the end, as if you are fogging up a mirror, but silently. That is 1 round. Do 5 rounds. Takes about 1 minute. If you want the stronger version, build up to 3 minutes, then 5. The research used longer daily practice, so think of the 1-minute habit as your trigger and the longer version as the upgrade. Now listen carefully, because most people ruin this. They suck in their stomach on the inhale. Wrong. They breathe into the chest. Wrong. They rush the exhale. Wrong. The power is in the slow exhale. That is the signal that tells your body, you are safe now, you can let go. And yes, that includes your gut. Here is the best daily action plan. In the morning, before coffee, and before breakfast, drink 1 cup of warm water. Then do 1 minute of tandem breathing. After that, walk for 5 minutes, even if it is just around your kitchen, hallway, or driveway. At night, do another minute of tandem breathing before bed. If you feel especially backed up, add 5 minutes of clockwise abdominal massage. If you tolerate prunes well, take a small serving in the evening, not as a snack attack, as a tool. What should you expect? In 3 days, many people notice less pressure, less trapped gas, and a softer belly in the morning. In 1 week, bowel movements often become easier, less dramatic, and more regular. In 30 days, this is where the real shift can happen. Less bloating, less straining, better rhythm, a flatter-looking stomach from less backup and less swelling. Maybe not because you suddenly burned fat overnight, but because your body finally stopped carrying what it was supposed to release. And that word matters. Finally, now, a few mistakes you need to avoid. Do not overdose fiber while staying dehydrated. That can make the blockage feel worse. Do not depend on stimulant laxatives every day unless medically directed. Your gut can get used to outside force. Do not ignore red flags. If you have blood in stool, unexplained weight loss, vomiting, severe pain, pencil-thin stools, anemia, or constipation that is new and persistent, get medical help. This video is not a diagnosis, and do not expect one perfect day to erase years of dysfunction. Your gut loves repetition, quiet repetition, the kind that seems too small to matter until it finally does. So here is your challenge. Try this for 30 days. Warm water, 1 minute of tandem breathing in the morning, 1 minute at night, a short walk after meals, massage only if needed. Track 3 things: your waist in the morning, your bowel movement frequency, and how heavy or light your stomach feels. Because once you can measure the change, you stop guessing. And when that trapped, swollen, backed up feeling starts fading, you realize something important. You did not need another fake detox. You needed your body to start moving again. If your gut has been quietly holding you back, this could be the habit that helps you let go.